Okay. Well, thank you. You can come back into this space now. I want to acknowledge the country on which we are learning today. And we're coming from Illawarra Shoalhaven Local Health District, and I know that many of you, maybe if you just pop down the side where you are, your name and where you're situated at the moment. I can look out and see the beautiful Mount Kira. It's absolutely beautiful, and that sun shining out there. So I want to acknowledge the traditional custodians of the land in which we work and live, and we're learning today. We acknowledge those who've come before and continue to be the caretakers and custodians of this beautiful land. Respect is extended to elders past, present, and any emerging here. So thank you for coming today. We're very excited to have our lovely Emma Radbron, now Dr. Emma Radbron. The pleasure of working. Val's here, I saw Val somewhere. We worked with Emma down here in the Illawarra, and we've asked Emma, she now has PhD, so we call her Dr. Emma Radbron. And she just completed that recently. Was that this year?
Yeah,
Emma?
It was. Yeah. Finally conferred early this year.
Yeah. And so she explored how nurses and midwives use data generated by a mobile health app called Impact to inform person-centred practice. And that was underpinned by person-centred theory and practice development principles. So that sits really beautifully with what our purpose is of a group. And we've actually asked Emma to talk about the SIP principles. So most of us have heard them. The collaboration, inclusion and participation of those that we work with. But I think Emma's going to talk about that in terms of her own research. So she's going to talk about it in terms of practice and research as well. So we've asked Emma, does she want stopped for questions? And we thought perhaps what we could do is maybe just go down the side and put a question in, and either myself or Susie will keep note of that. So lovely to see all these people from Prince of Wales. Hobart, oh, welcome. Oh, the Gold Coast as well. Is that you, Emma? We know where you're from. And sure. Jackie, you're from Brisbane too. And a few of us around the beautiful New South Wales. So welcome everybody, and welcome Emma. Emma's going to talk for about 30 minutes or so. We'll watch. We'll see how it goes. We might get away a bit early. We might be here till 3:30, and Susie and I will moderate the chat. But we kind of thought it'd probably be good if you can wait till the end, and then we can ask Emma the questions directly. But we'll keep an eye on that. So thank you, everybody. And I'll hand over to you, Dr. Emma.
No worries. Thanks, Denise.
So lovely to see that.
Yeah, it's pretty fun. My married name isn't as fun as Radbron, so I'm sticking with Dr. Rad for now, but I'm sure that will wear off pretty quick. So good. Well, thank you so much, Denise and Susie, for the opportunity to be able to share with everyone today and connect with you all. I'm very, very grateful for the opportunity. Before I dig into research and the SIP principles, I thought I would introduce myself a little bit. So, like Denise said, my name's Emma, and I started my nursing career in 2009 at the Kids Hospital at Westmead, and I worked there in the emergency department for over 12 years, slowly changing my working hours as I became exposed to practice development and research. For me, that started when I was a clinical nurse educator and part of an education development program run by members of the Nursing Research and Practice Development Unit, led by Professor Val Wilson. And it was at that point that my eyes were open to a completely new way of working and a methodology that aligned with my values and beliefs and my passion for collaboration and person-centeredness. And so through that, my career took a few different turns into I did the nurse manager role for the Essentials of Care program for a short period. I then led a nursing research project at the Illawarra Shoalhaven Local Health District, and completed my PhD, as Denise mentioned, at the very start of this year. And you can see my amazing supervisors and I at the point of PhD submission, just there in the bottom left hand of the screen. So I was lucky to be supervised by Professor Tanya McCants, Dr. Beck Middleton, and Professor Val Wilson. And I'm incredibly grateful for their input, and know that I wouldn't be able to be here today sharing this information with you without their support. Aside from being a registered nurse, me as a person, I'm pretty curious, and fittingly am a cat mum. That's my cat Bonnie, you can see on the screen, and we both share a love for people. She's very, very needy, but I love her for that. And I'm very grateful to have had her join me up here on the Gold Coast. I moved up here at the end of 2021 as I married a Queenslander. For anyone who goes for New South Wales and State of Origin, like, please don't hold that against me. But I do love adventure. I love sport. I love being outdoors, and have had many great experiences out in nature that actually helped me a lot during my PhD. I've also become a bit of a novice plant mum, and I say novice because I'm a big rookie in that space at the moment. But I think that ties into my desire or interest in growth and nature. So hopefully with a little bit of background about me, it will help my research make a bit more sense. So what I would love to do is to, while everyone's put the locations that they're from in the chat, I'd love to hear from you. What roles are you in, and how can I tailor my presentation today to suit the needs of this group, as this is my first time joining with you today. So if you can pop in the chat just a couple of words around the kind of space that you work in. Is it research? Is it practice? Is it academia? Is it leadership? What spaces are you working in? And yeah, let me know a little bit about you.
There's quite a few leadership ones there.
Yeah, definitely. And great to see some people working in the clinical space. Great variety. This is awesome, seeing some people working from practice development backgrounds, research, clinicians, even the GP space, culture, education. Awesome. So we've got such a diverse group here today, which is amazing. So I'll do my best to make sure that the presentation is able to touch on areas that are relevant, hopefully, for everyone in this space. And if you do have questions, yeah, definitely more than happy to answer them. So in terms of what we'll cover in today's masterclass, we're going to go over the PhD research that I was able to lead and be a part of, the underpinning theory. Then we'll look at how collaborative, inclusive and participatory approaches were incorporated into the research. And then I'm going to provide you an opportunity to reflect on your own practice and how you can incorporate those SIP approaches in your work. And finally, definitely open for question and answers. Hopefully we'll have some answers coming from within the space, not just me. So a little bit of background to the research I was able to be a part of. When I was working with Professor Val Wilson in the Nursing Research and Practice Development Unit, an opportunity came up where herself and Professor Tanya McCants were testing an app that measured 8 person-centered key performance indicators. And so before engaging as part of that feasibility study, we looked into how mobile health apps were used. We went to the literature and said, okay, we're part of testing an app that captures data on the patient experience. What is known out there about how mobile health apps are used to collect data, specifically for nurses? And then how do they use that data? What do they do with it? Do they use it to improve person-centered practice? Now, when we looked at the literature, there were heaps of mobile health apps available. This was back in 2017. And although there were lots of apps being developed, the studies and the evidence was reporting that the focus was on app development and feasibility testing, not actually about what the apps were used for. What do people actually do with the data? And so we noticed that very few apps, we looked at the ones that were being tested, very few captured data relating to the patient experience. Most mobile health apps captured numerical data relating to systems and disease processes rather than the people experiencing care themselves. There were lots of apps about healthcare monitoring. And obviously this increased through COVID when it came to telecommunication. But there really weren't very many apps out there that captured data on the patient experience and were relevant to nursing. There was also a scarcity of evidence available reporting how people used those apps, what the data was used for, and the teams that were involved. So we recognized that there was a pretty big gap in that space. So this then influenced the focus of my PhD study. And the aim of that study was to explore how nurses and midwives generate data to evidence person-centered care using a mobile health app. Now you can see we've narrowed it down to just be one singular mobile health app, because to look at this broadly was going to be too intense. So we formulated 3 research questions looking at how nurses and midwives engage how they generate data using apps to improve person-centered care, how they engage with that data. So what do nurses do? I know we can collect lots of data using mobile health apps. There's plenty of evidence to say that you can collect data, but what is actually being done with that data? Do they use it? How do they use it? How are they engaging with this evidence to see that translated into practice change, particularly person-centered practice change? And then lastly, looking at, well, how does working with this kind of evidence in this way influence nurses and midwives to be person-centered in their practice? So they were the 3 main research questions that my PhD explored. So my PhD was underpinned by the person-centered nursing framework. I was talking to Susie earlier and she said that in some of your local health districts, you work with the person-centered practice framework, also developed by Professor Brendan McCormack and Professor Tanya McCants. Looking at more the systems level is the person-centered practice framework. But the person-centered nursing framework is specifically developed for nursing. And that's why we chose to use it in this context, because my study was looking at how nurses and midwives use this data and how they engage with mobile health apps. So this was our theoretical underpinning. My study was also informed by practice development principles. Now, practice development is an improvement methodology that centers on person-centeredness, flourishing, enabling safe and effective workplace cultures. It also has a strong emphasis and focus on collaborative, inclusive, and participatory approaches. It has a value for facilitation, and when engaging in improvement processes, facilitation is a really key component that enables people to take action, research their practice, and ensure that that is informed. It also uses active work-based learning to facilitate individual, practice, cultural, and system transformation. And for me, this was a really important point in that it wasn't just about improving practice for the people we were caring for, but hopefully by engaging in research, we would be able to see individual transformation as part of the process. So these 2 elements underpinned the research that we undertook. In terms of the research process itself, my study used a methodology called participatory action research. Now, action research seeks to work with people and not on them as a way of solving problems and challenges. And for me, participatory action research in particular was the best fit for my level of expertise at the time, for my values in working with people in collaborative ways, and also my desire for reflection and change. So that's part of the reason why that we picked, the best research methodology was participatory action research. So as the name suggests, participatory action research involves participants collaborating together to research their practice, to reflect on the data that they collect, develop changes, and then implement those changes as part of the research project. It's quite different to more traditional approaches to research, where research is done on people or for people, not with people. So it was really well suited to working with clinical teams in the Illawarra Shoalhaven Local Health District, and also for me as a person. So in terms of how the process of the study went, I worked with 6 clinical units across 3 different hospitals in the Illawarra Shoalhaven Local Health District. And the study was from 2018 to 2020, which you can see there on the screen. So those 6 clinical units were from a range of specialties, including midwifery, day surgery, oncology, short stay, head, neck, surgical. So there were a lot of variety in the teams that I was able to work with. And these 6 units were part of a broader study which was testing the app, and the app's called Impact, and I will show you more information about that in the next slide. But the 6 units were engaged in a broader study testing the app and how it worked, and my study came alongside it and looked at, okay, well, how are the teams using the data? What are the supports they need in using the app? And then what is the influence this is having on them? So there are a few different data collection methods we used throughout the course of the study. One of them was a pre and post survey using the person-centered practice inventory developed by Paul Slater and his team at Ulster University. We used that as a before and after survey with staff to understand their perceptions of person-centeredness and whether or not that would change as a result of us interacting in a collaborative way to research practice and develop changes. I then engaged with the teams through 3 cycles of action research, or action cycles. And in those cycles, we collected data using the app, reflected on that data as a collaborative team, developed changes, and then implemented those changes to practice, and then repeated that process. On each of the 6 clinical units, we had action research teams where there were a range of designations. All of them included the nurse manager or midwifery unit manager. A lot of the units also featured clinical nurse educators, clinical nurse consultants, clinical nurse specialists, and then also nurses working on the floor. So there was a good range of staff as part of these action research teams. And we sort of led the process together, where we worked out how the team was going to use the app to collect the data, how we were going to feed that back to staff and communicate that information to be able to understand those results and then take action in response. I will just say that although this is a nice sort of smooth looking diagram, the reality of research and practice when you're working in collaborative ways is far from linear and far from smooth. But I had to put it in a way that looked nice for our publication. But this was the essence and the overall research plan. At the end of the study, I also engaged in interviews. So I did qualitative interviews with the members of the action research teams, and there were 19 staff involved in those interviews as well. And if you'd like to read more about the research itself, I've got references at the end of the presentation. So the app that we used was the Impact app. And I've just got a screenshot here of what the login page looked like at the time we were using it. So Impact stands for Implementing and Measuring Person-Centeredness Using an App for Knowledge Transfer. And it's sort of summarized here in really little writing there for you. But this app, like I said, captures data on the 8 person-centered key performance indicators developed by McCants et al. 2012. The way it captures data to measure those KPIs is using 4 different data collection methods. So we'll start here at the top. So surveys, patient surveys were used, and the teams were required to collect 1 patient survey per bed in their units. They then were required to do what was called observations of practice. So someone stood with the app and over a 30-minute period selected when the nurse was visible to their patients over that time frame. There were also patient recorded stories where we would sit with the patients and ask them about, well, what's it like to be a patient here on this unit? Tell us about your experience. We transcribed those interviews, and the team then went through that data set, looking for evidence of the key performance indicators and looking for positive and negative comments from the patients. There was also patient record review, so where we looked at the clinical notes written by the nursing and midwifery teams and looked for evidence of what was important to the patient. Was that actually reflected in the patient's documentation? Often we will report tasks and things that we've done, but very rarely in nursing documentation do we capture what's meaningful for the person. So these were the data that were collected using the app, was then generated into reports, fed back to the teams, and then I facilitated workshops with the teams where they were able to make sense of that data, understand what it could mean for them, and then develop changes based on the feedback that they had received from collecting data using the app. So in terms of some of the key findings, and I recognize this isn't all of the key findings, but I wanted to keep it short and sharp for today. Some of the key findings that came out of the study, one of the big ones was the importance of getting everyone on board. Now, this is in quotes because it was one of the key themes that came out of the qualitative interview data. It was really important for the teams to have a mix of designations involved in the research team, but not only as the research team driving the project, it was important to get the broader staff team on board, allowing the teams to use the app to help each other in collecting data, to come together and actually try and make sense and reflect on that data, thinking about what does this mean for us? What does this say about the nursing care we're able to deliver? And where would we like to go from here with that information? So it was really important that we were collaborative in this approach, using the app and the data. External facilitation was also a really key contributing factor to the success of the study, and all participants mentioned the value of having external facilitative support. So for me as a researcher, in action research, there are two main positions that you can take. You can be an outsider researcher working with teams that are unfamiliar to you, or you can be an insider researcher working with teams that you are known by and work with. So for me, I wasn't from the Illawarra Shoalhaven Local Health District, so I was an outsider research in this study. And the teams mentioned how valuable it was having someone who was outside of the clinical teams being able to come in and support. I wasn't part of the cost center. I wasn't influenced by the time and the work pressures and the workload going in the unit. I was able to come in and work with the teams, and having that support and guidance was invaluable for them. It helped them understand the research process. It helped them understand how to use the app. It helped them keep on track, and it also helped in feeding back the data to the broader teams. In the study, engagement with this data was strongly influenced by the nature of the data that was being collected. There are so many mobile health apps out there and they collect lots of data, but unless data is meaningful for staff and practice, the likelihood of them using that data decreases. So the teams reported how valuable it was to have data that captured the contribution of nurses in relation to person-centered care, and having this data helped them see things differently. The next point there talks about how collecting and reflecting on the data actually reminded staff that there's a person in the bed, that the people they're caring for aren't just bed numbers or disease processes, but they're an actual person. One nurse I remember in my interviews was actually saying that when the gown goes on, the patient goes away. But impact and using this app and using this data in this way actually really changed that for her and reminded her that these people we're caring for aren't disease processes, they're human beings and they're people. So the value of that data being related specifically to nursing practice really made a big influence on them being able to use that data to improve practice and also celebrate the great care that they were delivering. So there were numerous changes implemented in response to the data throughout the time we were going through the cycles. And like I said, they were used to celebrate or improve person-centered practice. Often when we receive data or we're collecting data, we focus in on the negative. So we really tried to make sure that teams paused to go, well, actually, what are the good things that this data is saying about the care we deliver? It's important to pause as nurses and celebrate the great care that we're able to provide. Yes, there's always going to be room for improvement, but actually, most of the time, we're doing a really great job. And this made a really big difference for teams. I'm going to share some of the changes that we implemented in the next slide as well. So hold on for some more specific examples. By engaging with teams in a collaborative way, we actually not only saw changes implemented to practice, but improvements in their KPI results over time. And this was really encouraging for the teams. There are a lot of comments about, we can see the progress that's taken place for us from the beginning to now, not only understanding how to use the app, but also understanding how we can engage in research and noticing personal improvement. One of the nurse unit managers said that this is probably one of the best research projects I've ever been a part of. And I know now that we can use this evidence as ammunition for change. And they were her words. But it was really beautiful to watch the transformation that was happening in individuals as a result of using collaborative and inclusive and participatory approaches to research and practice. Finally, in answer to my third research question, we were able to see statistically significant increases in perceptions of person-centeredness among nurses and midwives involved in the study. And that was really exciting too. So some of the changes that we were able to see in practice, coming back to the methodology of action research, we wanted to see changes occurring as part of the process. So here's some examples of those changes, and it's mapped back to the person-centered nursing framework. So we saw teams develop nursing shift planners, running education sessions regarding medications and identifying gaps in their practice. We saw handovers of patient care taking place back at the bedside based on feedback that the patients had provided. We saw more technical changes like fixing bedside tray tables, purchasing extra urine bottles, fixing toilet seats and lighting in the toilets. In one unit, they installed a brand new patient buzzer system to ensure that they were able to respond to patients in a more timely way. Teams also developed appreciation boards, so where compliments and positive quotes from the patients they were caring for were displayed in the tea room as reminders to them of the great care that they were able to deliver. There were changes to documentation templates to be more person-centered. They made changes to their nursing orientation packages. There were changes to models of care to adopt a team nursing approach involving both the permanent and the casual staff working in the units. They implemented staff recognition programs like Employee of the Month because they realized that celebrating the good care that they were delivering was something they wanted to continue. There were more changes also for patients in providing earplugs and reducing noise in the department, particularly at nighttime, based on that direct feedback from patients. One of the strongest changes, and one that the team said will never change now, was that they made a change to their nursing staffing. Now, they didn't get extra staffing because we all know as clinicians that, finding extra staffing or funding from extra staffing is pretty darn hard. But what they did was, by reflecting on this data, the patient's feedback and how they were feeling about practice, they changed their staffing profile to ensure that they had one extra nurse on a night shift. And they said that this change was a real game changer for them. It meant that they felt safer and enjoyed their shifts more, that the patients were able to have greater attention brought to them by the nursing staff. And obviously that would lead to patient safety and improved patient experience. And so they've said, even when I followed up with them after the study, we're never going back to having 3 staff on night shift. And so this occurred as a result of these collaborative, inclusive, and participatory approaches to research using meaningful data. So in terms of how SIP approaches were incorporated into the research, well, it's pretty clear to see, I hope, that it was actually, they were incorporated in every stage of the research. In the planning stage, I was guided by person-centered theory and practice development principles. I chose a methodology that aligned with my values regarding person-centeredness and collaboration and my love for working with people as a nurse and a person. I chose a methodology too that valued that participation. Often in practice, we can aspire to work with teams, but due to time pressures, funding, limited resources, and competing priorities, sometimes we defer back to more transactional ways of getting the job done, or engaging in quality improvement, or completing research. But it's really important to reflect on, well, what are our values and beliefs, and what are the values and beliefs of the team we're engaging with? What's a methodology that suits? What's a research approach, or what's a quality improvement approach that aligns with those values and suits the needs of the team and the aims of the research? Or even the project, if it's a project that you're working on. I know I'm talking from a PhD study, which can be quite big and intense, but as a clinician, well, what principles can we use to inform our approaches when we're developing or thinking about our practice? So it's important to ask yourself critical questions about your intentions of the research. What is it that we're trying to achieve? Do we want to just do research, or do we want to see sustainable changes in practice? And that all needs to be considered right at the planning phase of any project or research that you might be involved in, particularly when it comes to apps. Another thing that was important was thinking about infrastructure. What is the planning involved there? How are we going to actually work with the teams? Do we have the right processes in place to enable collaborative, inclusive, participatory engagement in this study or project? When it came to engagement, the SIP approaches were applied through helping staff understand the relevance and the benefits of the process. Staff had agreed to be part of the study and the broader feasibility study before my PhD research began, and I came alongside them partway through. And it was in sitting down with the teams, connecting with them as people, understanding, well, what's your impression of where this research is aimed at? What's your understanding of what the app does and how it could work? Helping teams understand, well, what's in it for me? And how is it that we can work together? So I used some tools called the ways of working, which is quite commonly known in practice development. And we developed, based on our own values and beliefs, what are our agreed behaviors? How are we going to work together? And we had to refer back to that at times through the study. Each time we got together, or each time new members of the team were added, we came back to the ways of working, because the reality of healthcare and nursing practice is there's always a high turnover. So there were quite a few changes in our teams over that 2-year period, particularly in leadership roles. So having the way of working helped us come back to, okay, why are we here? How are we going to interact with each other? What is it that we are trying to do here? And how can we do that together? Also, in clarifying the staff understanding of the purpose of the research, I used another exercise called a values clarification exercise, or VCE, and that was developed by Warfield and Manley, and the reference is in my final page. But that was a really helpful tool in generating momentum and maintaining momentum throughout the study. There were some teams that were a bit hesitant in the process, and when I sat and chatted with them about, well, what is this project about? What does it mean to you? What do you believe is the purpose of this project? How can we, just establish a common understanding? And this values clarification exercise really helped uncover some gaps in people's understanding of who they thought the project was for, what it was about, and the level of involvement that they could have. So it really encouraged engagement of staff on all levels and helped teams feel empowered to ask for help or ask for my involvement in trying to facilitate the involvement of more clinical staff as part of the team. In relation to facilitating the process, so collaborative, inclusive, and participatory approaches were involved throughout the facilitation of the research itself. So I worked with the teams in collecting the data to use the app and understand how to use the app. I ran lots of education sessions with teams, helping them, get familiar with how to use the app, how to collect that data, working with teams in collecting patient stories as well. So developing those research skills of the team, and not just me going in and doing it for them, but allowing sometimes for them to sit in with some of those qualitative interview processes and be part of that process, developing their skills and their confidence in collecting data themselves. Also, in the research project process itself, when it came to understanding the data, I generated reports and then sat with the research team and we unpacked that together. What does this mean? What could that mean for you and your practice? And then unpacked that with the broader staff teams. So we aimed to connect with 70% of the clinical teams on each unit. And we did that over multiple sessions where teams were presented with the data and then asked to reflect on their practice in developing some suggestions for celebrating the great care that they give and also improving the care delivery. So I was very intentional in making sure that the data was fed back to the broader staff team, and ensuring that those sessions where staff were able to be a part of understanding the research were given enough time, and that I ran as many as I needed to try and capture as many staff that were interested. I think it's really important when we're engaging in research and quality improvement that we feed data back to teams. How often have we been involved in research studies over the years as clinicians where we've completed a survey or been interviewed or been part of a research process, but then never heard anything about it? The beauty of action research was this cyclical approach where we could keep revisiting these results. And I was intentional that if we weren't able to capture staff, that we chatted about communication processes that would work for the team. So there was emails sent out or newsletters that were created by the leadership teams where they were passing on that information. Copies of the data reports were left in the tea room or stuck up on the back of toilet doors. And we used other complementary data sets in uncovering person-centered practice and nursing practice. Finally, in writing up and sharing the results, I've kind of touched that on a little bit already, but when I was writing up the results of my thesis, I checked in with the teams that I had collected data with and from as part of the qualitative interviews. And I made sure that what I was deciphering made sense for them. I sent them the reports when we developed an implementation report, and got feedback from staff, and then made sure that all publications were disseminated to them as well. I included them in photos when there were presentations done over in Switzerland and then again here in Wollongong here in Australia. So really wanted to make sure that I was living by my values and including other people in the process, and incorporating those practice development principles of collaboration, inclusivity, and participation, which have been tried, tested, and published in so many different spaces now. So that's a bit about me and my research, and how I was able to use the SIP principles or SIP approaches. What I'd like for you to do now is to take a moment for personal reflection. So masterclasses aren't just about someone talking at you for an hour and then you carry on. I'd love for you to have a moment where you can just sit and reflect. And so I'd love for you to write down, and you don't have to share this in the Zoom chat, but on a scale of 1 to 10, how often are you using collaborative, inclusive, and participatory approaches in your practice or research? So just take a minute to do that. Once you've given yourself a bit of a score out of 10, I'd love for you to think about and write down, well, what evidence do you have to support that score? If you asked your colleagues if you used collaborative, inclusive, and participatory approaches, what would they say? What about the outcomes or the outputs of the projects that you've been involved in? What about just your approach to practice? What evidence do you have to support how often you would use collaborative, inclusive, and participatory approaches? And finally, what is one thing that you can do to see that score improve? Perhaps it's some of the examples I've provided today that can be applied to not only nursing research, but nursing practice. So you don't have to write lots of things, because often if we write lots, we may not do any. But if you maybe can think of what's one thing that you could do to see that score improve. And I'd love for you to share that in the chat if you feel comfortable to. What is one thing you could do? How could you apply what we've spoken about today when it comes to SIP approaches in your practice or research? So as you're thinking about that and reflecting on your own practice, I'll just share the references here for you if there's anything that you would like to read more about after today's presentation. And I'm happy to share these slides if people would like to learn more about what happened in this research process or any of the theory that I've touched on so very briefly. Also wanted to create the opportunity for connection. So if anyone would like to connect with me after this presentation, I'm always really interested in hearing about what's happening in the healthcare space, particularly around person-centeredness, practice development, action research, knowledge translation, or if you just have some feedback after today's presentation, more than happy for you to email that to me there or follow me on Twitter. And if you would like to have a look at my thesis, which is a very long read, so there's definitely no expectation there. But if you search Emma Radbron at Wollongong University, it will come up there for you. And I could probably just copy that and put it in the chat if anyone did want to check it out. So I guess
sorry, Emma, we just had something commented about improving the collaboration through in-person meetings instead of the MS Teams where possible. I think we've moved a lot to that kind of team forum, haven't we? And it seems easy, but it sometimes does miss our connections.
Definitely. Yeah, so creating a space where people can collaborate, where you can do in-person meetings, that's always going to be ideal, I think. But if it has to be online, well, how can you make that more personable? What are some creative ways that you can do to help people collaborate? That's awesome. Thanks for sharing that.
Yeah, there's some stuff there about continue to feedback meaningful data as well. There was some other comments there that looked quite nice. Sorry, I've got a bit of a cold coming on.
That's okay.
And I like Susie says, continue to pause and ask who else. Is there anybody missing? Yeah.
Great.
And there's some stuff there about the data sharing.
Feeding back that meaningful data to staff, so important. It was really a standout. Making sure that, if we're not getting engagement, well, do people know what's happening? And reflecting on, well, why? Who is missing? Like Susie said, who else? I think that's a great question to ask. Sarah, I agree with what you've said too. Yep. Yeah, about local champions taking charge rather than the leadership teams. Let's make sure that power is distributed evenly amongst the teams so people feel confident and comfortable to research their practice. And then great, Arthur, reflecting on, so we've looked at the data, but what has changed? We were looking at with the teams in this study about, well, what improvements have happened and what results have decreased? What is it that we can do to see that continual improvement? And how can we evaluate it? Sometimes these initiatives we develop don't work, and data is helpful in identifying that too. So thanks, Samantha. I can also see that.
Questions?
Yeah, definitely happy for questions if anyone has questions.
Pop your hand up. I'm not sure I'll be able to see you. There's so many of. At one point, there was 121 people. So, where have you gone? No, I've lost everybody. Pop your hand up if you've got anything. Oh, just popping through here.
Yeah, I'm pretty inoffendable, so go for it. Well, at least I'd like to think so.
Yeah, there doesn't seem to be any hands up, Emma, but there's a lot of comments down the side about thanking. That was from Val, your lovely supervisor.
No worries.
And yeah, and congratulations on your work as well.
Thanks,
Emma, would you
everyone.
be able to just go back? Yes, but it's really important that we see that we're meeting the mark and that you enjoy the master classes. So please, if you've got your phone, just pop it up, take the QR code. It's helpful for us to decide. And if you've got anything that you want for next time, then please write up what kind of things that you would like, because we're always kind of scratching, going, oh, what's next? What's next? We had Emma tucked away for a bit later in the year, but we brought her forward, which was great. There's lots of nice comments there, Emma. I'm not sure if you can see
Yeah, I
them.
can see them. Janelle's asked if
Yeah.
I bottle and sell my enthusiasm. Look, if the price is right, Janelle, if the price is right, no.
Yeah,
I appreciate that. Thank you. I think
that's
it's about
lovely.
finding what you're passionate about and working in a space that aligns with your passions and your values. That's where I found I came alive, was working with teams and facilitating processes. And so if you tap into those values, don't have to leave them at the door when you come into nursing, research, practice, any of those spaces. So find a space where you can actually live them out, and that's where you'll come alive.
That's great.